Hello everybody, happy Wednesday. We are going live today with Chava for part 2 of our talks about psychedelics and KAP, which is ketamine assisted psychotherapy. We're just going to wait for some of you to show up, and Chava, thank you for joining. Let's get right to it. Here we go, invite. Okay, Chava, I invited you. Thank you for joining, everybody. Thank you also for the people that sent in questions. We will address them today, hopefully if there's time, and if not, then we plan to do even like a part 3. If I sound a little froggy, I feel like I'm coming down with something, hopefully just a cold, so bear with me. Chav, I think I invited you. One second. I'll try that again. I invited you again.
Okay.
Yes, that works. Hi, how are you?
How are you, Faye?
Okay, I'm hanging in there.
We're showing up.
Thank you. Alrighty, so we have a couple of good questions. We got really good feedback from our talk last week. I feel like it was a while ago, but I think it was just a week ago.
Yeah.
Okay, so I think we should just jump right in. And if people have like questions, I guess while we're talking, they can just like type them in. And otherwise, after this live, people can always send in questions. We'll probably address it in another live. This is like, I feel like a very dense topic and something that we could probably do another live on as well. Okay, so the first thing is like, what is ketamine and how it works? I guess like we maybe touched on it briefly, but like if you could explain more like the chemical compounds and like what it does to the brain.
Okay. Yeah, last time we didn't go into it because it can get complicated and that's not what everyone wants to hear. But I'm happy to try to explain a little bit. I'm not a scientist, but from what I understand.
Sure.
So ketamine is part of a class of drugs. It's included in the class of psychedelics, which popularly includes MDMA and psilocybin, ayahuasca also, and actually it is something that's been used since 1970 in hospitals all over this country to put people to sleep for surgeries in larger doses. It's still used very commonly, mostly with kids.
Kids for surgery, you mean?
Yeah.
Interesting.
It does not affect the heart or the lungs. That's why it's very safe as opposed to other types of sedatives. I'm sorry, not sedatives, tranquilizers. So it, in lower doses, can produce more of a light dissociative effect, kind of like in a trance state. But I can explain a little how it works on the cellular level. But the effect is, when we use it in conjunction with therapy, to loosen a person's hold on their anxiety, their patterns of thinking that kind of keep them stuck and away from their deeper selves. And it's not necessarily to give, we're not going after that psychedelic high experience, wow, near death. Although in different ways, it certainly can produce that. What I'm doing in my practice is only using lozenges that dissolve under the tongue, and they are a much lower dose. And this is ketamine is an FDA approved drug for treatment-resistant depression. And it's used off-label for many other purposes.
Right, so I guess like on a cellular, do you want to explain for like 2 minutes, maybe like what it does on a cellular level? Like how does it actually like reduce the defenses, I guess, of a client, right? To like help them open up more, I guess.
So we have something that it takes mostly associated with this part of our brain in the front, and together it includes a few different parts of our brain, and we call it the default mode network. And it's different. You can tell the difference in a child under the age of 6 to 10. They don't have functioning. They think very creatively. They fantasize. They're trying to piece together, to put together the things they've learned so that not everything is starting from scratch. And eventually they do that, and we create scenarios, stories, meaning this plus that equals the third. And the only problem is we get locked in these ways of thinking. And when we're at rest, our default mode network is what actually controls our thoughts. When we're chilling, we're thinking, we're judging, we're assessing, we're remembering, we're planning, unconsciously, consciously, and we don't even have to put effort into it. And this is why a person can have a panic attack and not even know why. Their brain is just operating, it's going through, it's checking files, you know.
On this like default mode network, is that what it is?
This network is just full of all their past experiences and the sense or not the sense they made out of it.
And all the like habitual patterns, even I'm sure positive things, not only the negative things.
Exactly. And that's how a person can get stuck in depression, anxiety,
So,
and I talked a little about OCD. So this is really how it works with OCD.
Yes.
It can reduce our reliance on that. What it actually does is it works on our glutamate receptors. So people are familiar with how antidepressants work with serotonin and epinephrine, and there's one more common one, dopamine receptors, right? So there are actually many more glutamate receptors that use glutamate. And what this does is, I'm gonna just read exactly. It reduces the it stops it from closing down, and it allows things to the glutamate to increase, to come through, and to allow a different way of thinking, not just that default mode network to go through, and allows us to come to use areas of our brain that are not usually used. It can actually prune old things that are not functional, that are not getting what we want, by having more glutamate, and create new neural pathways, more neuroplasticity is what that ends up.
So it's increasing the ability for our cells to get glutamine, is that correct?
I believe so.
Because it gets complicated on a cellular level. I'm not like a science geek or anything, so I don't know. Like, I wouldn't know the difference, but
you know what? You can do what I've done partly before I studied it, is look up things on YouTube. There's a lot of scientific based information there.
Got it.
Yeah, MAPS, MAPS, and Fluence are two places that are in the lead of running studies based on National Institute of Health, based on FDA funding, to research that is taking these things, like you mentioned to me earlier. People are asking a lot about ayahuasca.
Yes.
And things that are used more in religious ceremony, and people in other countries, it's illegal to use here. People take trips there to other countries to make use of them.
Right. I was surprised by how many people asked about ayahuasca in our DM.
Yeah. So I can't speak to that, but it is actually being funded by this country's government to use it therapeutically, to get it down to a science, full amounts, dosage, timing, so that it can be, because these are powerful substances. And what we've been doing is using such a limited amount for the past 50 years of antidepressants, a limited range of how it changes our brain. And this just opens up so much more. And it's been used in this country legally for 50 years also, just not in this
capacity
for this purpose. Yeah.
Right, exactly. Okay, amazing. Let's move on to the next question. Could you explain, I guess, like what happens start to finish in a session with KAP?
Sure, I would be happy to. So first, I either get a referral or suggest to one of my clients, or people just call asking, they're interested. What can I tell them about it. So we meet 1, 2, or 3 times, talking about their background, what it is that they want to get, where they are, their physical and emotional health, the drugs they take. You know, one thing you want to check for is that, you know, they don't have any physical pre-existing things that would make them not a candidate, heart conditions or stuff like that. And get a sense of the person's stability emotionally, and that they know what I'm going to be offering, which is a plan. Here's the problem. We can sit and do talk therapy. We can do IFS, EMDR. There's so many different modalities. This is one that works a little different in allowing you to have your defenses down a little bit. You know, that train of thought gets derailed a little and allows you to think more openly, to get a little deeper and to your memory, your experiences, your reactions, and allows you to feel more less defended and ready to talk about stuff that you might not have been able to or even remembered.
Yeah, I think that's like a perfect way of saying it. I know so many people struggle with like opening up in therapy or in their relationships, right? Like they have that like blockage, like they so badly want to open up and they can't. And I feel like this is something that like helps with that defense, right? And then like you also said, if they don't remember certain things, it's hard to talk about things we don't remember. So this is another way, I guess, of taking away the blockage of what prevents people from remembering certain memories, even if they're not the most like traumatic memories, but they might just be memories that are important in helping them heal. And this would help with that. Is that correct?
Exactly. So what we do is we talk a few sessions or 2. Then they meet with a psychiatrist. That's usually done online with the company I work with, which is Journey Clinical. And if they're a candidate, the ketamine is sent. We bring it to my office, and then we have a dosing session, which we give for the first session 2.5 hours or so. But the actual intense experience is about 45 minutes. It can be adjusted to a lower level, and if it's okay, we can add another tablet. There are 2 tablets to use. And we spend time preparing the intention, setting the mood for music, for calming, if there's blinders for eyes so you're not distracted, because what it really does is it takes a person, that's why they say dissociate, that typically that's not something a person wants to do.
Right.
You want to be present, but you know, you get scared, you get nervous, and you're gone. So this is rather a dissociation from all your outer senses. So you're not bothered by, you're uncomfortable and you hear something and you see something. You kind of get to go into your own world without your body's distractions, and notice what's going on in there. So the person will have the experience. Someone will be sitting with them. I will.
So the therapist. So it's a that session. Let's say session number 4 with you, the therapist. Right. It's a 2.5 hour session. So that's already like very different from your typical like 45-minute session with a therapist.
Yeah.
And then I guess like you first prepare. Like I'm assuming you prepared for the session in sessions 1, 2, and 3 on some level. But I guess within this session, there's also like more like preparation that happens closer to. And then
that's the point of having 2 or 3 sessions, to get comfortable so we know what's up for the person, what they want to work with, that we have some trust and understanding going on between us. So when they come in, we talk about 20 minutes. I know what their intention, what their goals are.
So that's the question of mine. Like, is there like a specific thing, like, oh, I want to work on, like, give me an example. Like, I want to work on fill in the blank. You know what I'm saying? Like a relationship, would they say, or like a disorder, or does it have to be much more specific than that? Like why I get angry at X. You know what I mean? Like,
yeah, I think the second, like you said, because a relationship, why are you having a problem with it? Because I'm impatient, because I have expectations, because I get too sensitive when I'm with other women. So yeah, exactly. It's usually and again, that's why we talked earlier. What are your dysfunctional patterns that you're stuck in that you need help from?
And then this one session would be focused on, let's say, if I'm impatient, it would be focused on impatience type of thing. Like that would be an intention.
So that's kind of like the sign on the marquee. That's the general place you're trying to go, because what prevents a person from what, the bad rep that psychedelic drugs have on the street is you're out, you're not necessarily in the safe place with safe people, and the intention in the setting makes a big difference in feeling secure. So we say that's where you're going, but once you're, in under the influence of the medication, your brain is going to go where it needs to go. Things will open. And the reason we call it therapeutic is because there's somebody sitting there. If you are sharing any of it verbally, I'm writing it down. We talk about it after about an hour, another 20 minutes afterwards to relax and come back to your body more. We have a short session, about 30 minutes to kind of write things down, remember, try to explain, because a person will say, this is just, there's no words, I can't explain it, I don't know what. So that's what we're doing. We're kind of having the experience, what we can from it, and then starting right the next day, we come back. Your mind stays relatively open for 1 to 3 days. So take advantage of that open state, and we come back and we have a full therapy session the next day. We start making meaning, making sense of putting the pieces together. You can spend months from one experience.
Yeah, that was another question of mine. Like, how far does one experience get you? Like, I'm assuming pretty far. Like, it's not like you're taking another dose the next week or month.
So there are many uses. If a person's using it to reduce PTSD and trauma symptoms, so yeah, you can have a whole lot come up. It can be not that much. It also depends on, is the person scared? How much resistance? So depending on how much of a dose and how often, what their goal is, we're going to dose it anywhere from once a week, once every other week, to twice a week for 6 sessions, and then see where, with a therapy session in between each one, because we're not just doing it for fun. We're doing it to grow. For someone who's using it for treatment-resistant depression, they will still keep using their antidepressant or anti-anxiety medication. And the protocol there is more like twice a week for the first month, and then reduce it to, once a week, every other week, maybe once a month, possibly indefinitely once a month, once every other month. And people that have had good enough, years of life on an antidepressant have amazing relief. So yeah, there are more people having greater impact of healing than with any other modality that we've used in the past 50 years.
Wow.
Which is why most therapists are, at the same time, we don't know, we're a little scared, we're cautious, we're professionals, but we're so excited.
Yeah, it sounds exciting. I had like a couple of thoughts that came to my mind or questions. So basically, it sounds like if it's not for treatment-resistant depression, it sounds like it's a protocol of 6 sessions, correct?
At the most, yeah.
At the most, and it would be up to the therapist to therapist and client, I guess, collaboratively to decide how, like in what succession those 6 sessions take place, anywhere from once a week to once a month, basically, probably not less than that.
Right.
And then once those 6 sessions are done, max 6 sessions, I'm not talking about, let's say, for treatment-resistant depression, because that's more of a long-term treatment. But once those 6 sessions are up, would you say like that's it? Like that's, or I guess my question is, could clients become dependent on it? That's one of my questions. Or is it like it does its thing and that's it?
So it's 2 questions, because it brings up the dependence and also the other possible negative side effects that, of course, people worry about and wonder. So first, the term is the same as you'd say for anything else. It's really individual. If a person is not down for long-term therapy, that's not what they came for. They needed that breakthrough. Will they necessarily have it the first time? or have that psychedelic experience? No.
Mm-hmm.
Um, but it's a buildup. It's a, you know, once something opens, it doesn't all flood out at once. You know,
Mm-hmm.
if you can remain in that state and working with those memories and experiences and states of being that it brings you to, you keep going. So you can continue your therapy, you can not continue your therapy, but more than likely you're going to want to, because you're going to make such big strides in,
Mm-hmm.
you know, in whatever it is that you're working to heal.
Right, but I guess my question is not necessarily to continue therapy, but to continue ketamine-assisted psychotherapy, meaning like, is that
Right.
something that people, let's say somebody's going just for like personal growth, is it something that they might, my phone's on
Yeah, no,
10%, or we're going to be wrapping up soon anyway.
there, yeah, you froze there a minute. So
Yeah, yeah.
again, people use it for different reasons, and there are different ways of giving it. There are the IV infusions that are for, you know, that I'm not talking to that. You
Mm-hmm.
know, it's dosed and given, and, you know, for different, for treatment resistant depression, certainly PTSD, OCD, anxiety. Um, but those may require a longer term
Mm-hmm.
commitment,
But the
but
typical,
it's,
is like
it's,
6
you know,
sessions and then they're taken to a relationship.
yeah, exactly.
Got it. Got it. Okay, amazing.
Yeah.
Okay, so you said it's like a 20-minute, that first session is 2.5 hours, 20 minutes of like setting the intention. Then they take the actual ketamine, and then how long till it takes effect? I'm curious. Like,
I'm sorry again.
how long till it takes effect, the actual
Oh,
ketamine?
it
Within
takes
that?
effect between 10 and 20 minutes
Okay.
at first. And
And
if the person feels okay, there's a second tablet that they can take.
mm-hmm.
Again, it's a much, much lower dose than intramuscular or intravenous.
Of
So
course.
it's not going to be, there really is no long-term damage. Like I said, it's used when people are at their most vulnerable, you know, for surgeries.
Mm-hmm.
So um, it's it's not something someone has to worry about, especially in these low doses.
Got
Uh,
it. And then
so
so like it takes 20 minutes obviously to take effect, and then during the time that it's effective, the client is conscious enough to be talking. Like therapy continues essentially with them being under the influence of this drug, and then I guess like the intensity, the main intensity. So let's say we're at 45 minutes already. So would
yeah,
it be safe to say that the main intensity then wears off within the next like 30 to 40 minutes, and then they have like the 30 minutes of being less under the influence to wrap up?
yeah, not even as long. You're really good at, you know, explaining it piece by
Just
piece.
like
I'm
trying to figure it out.
all over, but yeah, the full experience where you're under the influence of the medication is about 45 minutes.
Got it.
But it takes another good 20 minutes, but we give a full hour afterwards to come down and get back to yourself, regain your balance. We have a snack
Mm-hmm.
afterwards just because we ask the person not to eat beforehand.
Mm-hmm.
There are some possible side effects, although they're usually mild, dizziness, a little nausea, not, you know, maybe 30% of the people,
Uh-huh.
and they go away very quickly.
Mm-hmm.
No long-term effects.
Got it.
So we give that time during those 45 minutes, really, if the person wants to talk, they can, but we allow them that private, you know, to go inside, to have that
Mm-hmm.
experience. They need to get up and use the bathroom, you know, we just make sure they're okay and go with them
Mm-hmm.
to the door and
Mm-hmm.
bring them back. And usually a person's laying down in a recliner, or we can open up a futon,
Mm-hmm.
comfortable, safe, a blanket,
Mm-hmm.
nice, some nice music.
Sounds cozy. Sounds cozy.
Good. And then, like I said, after about that first whole hour, then
Yeah.
we start talking and
Got it.
making a
Got
little
it.
for what's to come.
Got it. Okay, amazing.
Yeah.
I'm looking at the time, and I just hope my phone, if we totally get cut off, it's because my phone died, but we're hoping it's gonna last the rest of the next 5 minutes. Okay, amazing. I have like a really good idea of like what a session looks like, which I think is important. I mean, like if I was somebody that was interested, I would want to know like exactly every detail, which I'm sure as a parent at this point that I'm very detail oriented when it comes to these things. So I feel like it's really good to give people that idea. What would you say are the risks? Like that's what people asked also, like does it permanently change the brain? I know we spoke a little bit about like dissociation. This type of dissociation is different. So I wouldn't say that that's like a risk, because this is very like time limited and used for a certain purpose and intention. But what would you say are like more long-term risks potentially, or even short-term risks or things like that?
So I do want to make a very clear distinction, because this isn't something that's new to the majority of us, that this is something that's done like any other medication that people use all the time without thinking. You
Sure.
take, so it's FDA approved, it's legal, it's and only really dispensed by doctors that know what they're doing with this. So however much someone's going to trust the government and the FDA to approve substances they put in their body, this is really no different. When I read, aside from everything else that I learned, that it's still commonly used in children in hospitals, I said, okay, they don't do that if there's long-term effects, and it's been studied for 50 years at least. So that really is not a concern. The changes in the brain that it allows are temporary while the medication's in your body, although the great thing is, unlike a typical SSRI, the effects can last. Once things are opened, you get new neural pathways, new ways of thinking. You're not locked in. And your body stops telling you something is dangerous or must be this way. And you can do things different. And
then I guess in a sense it does change the brain, but for the better, I'm assuming, right?
Yes. So many studies I've read for over many years, and
no like permanent brain damage from this.
Not at all. No.
Okay, amazing. Okay, we touched a bit on like how it would help with OCD. Would you want to just touch on that for another minute, like how it specifically would help with OCD?
Well, using the idea that the default mode network is the way we think, somebody with OCD has got that, 100 times more than the typical person. While I'll like go through my morning routine, I know I get up, I wash, I take a shower, get dressed, make up food, an hour. And I don't have to think about it. I know where all those things take place and how to do and what they do. And somebody with OCD is going to get stuck
somewhere along the line.
Right. Their train is stuck on, wherever their compulsion or obsession is. So this kind of, like we said, derails that regular mode of thinking, so they can expand. They're not stuck in it.
Got it. Very cool.
Not something anyone wants to do, but when your brain's telling you you have to, you know.
Got it. Okay. Say that again. Say that last thing.
You need some help to stop it. It's a physical thing.
And it's been proven, like with studies, because I know that it's been heavily proven and like used in treatment for treatment-resistant depression, but has it been very much extensively treated, like used as a treatment for OCD?
That I can't really answer, because my really is more with depression, because that's more what I deal with. But it's the mechanism of how it works. It makes sense. And I was just listening this morning to a scientist who ran exactly that that study on OCD.
Interesting.
And it seems to work with lasting results, because once the train's on another track,
it's easier to stay there.
A different way to go. Yeah.
Amazing. Okay, and then somebody asked a question here, which we said we would address. Shidduch Dating Life Coach said, how does the experience compare and contrast with ayahuasca and other psychedelics? So we discussed that, I think, initially, briefly, and you tell me if I'm saying the right thing, that those ayahuasca and other psychedelics are currently not legal to be used, at least in the U.S. There's a whole, there are multiple organizations like MAPS and others that are working to make them legal after they've been tried and true and tested and proven. But all those experiences are much more like trial and error at this point, so they have a much higher risk. But I think
I wouldn't necessarily say they're trial and error. That's how they are seen in this country. But things that have been used for 5,000 years, traditionally,
Right, but I feel like if they're not like it's the dosaging and all that, like if it's hit or miss, like it's dangerous if you're given too of a high dose that your brain can handle, or you're not in enough of like a supportive environment, then that's when psychotic breaks happen and things like that. So we don't want that happening. Right. That's why they're not officially legal yet.
Exactly. Not that there is not psychological benefit to them, but it's nothing we're talking.
But the idea, I guess, to answer this question also in another way, is saying that these are both KAP along with these other drugs are all psychedelics. They all do the same thing in the sense of helping somebody get into a dissociative state for one purpose or another, hopefully for a therapeutic reason, and done in the right environment under the right controls, they can be useful and beneficial. The thing we're talking about here is KAP, since that's already legalized and done in a way that's safe and therapeutically supportive.
And, you know, we all get it. As therapists, it's good to us too. And most therapists will tell you if they know anything about it or refer you further. And I'm really happy to answer anyone's questions.
Amazing.
And it's something people should be cautious about.
Sure, absolutely. And I think giving education is like the first step to like helping people be cautious. You know, like this what these lives in this series is not like a promotion of any way, in any kind, in any shape or form. This is all just giving people education and awareness that they're not getting it from the wrong places. Hope that intention like carries through. Thank you so much, Chava. I really appreciate your time and your expertise, and thank you everyone for tuning in. And we will probably do a part 3 if there are enough questions that would make that necessary or appropriate, and we're looking forward to that. So you can DM your questions, and thank you all again for tuning in, and thank you so much, Chava.
Thanks a lot, Faye.
Take care. Have a great rest of the day. Bye-bye.
Bye-bye.